All right, great. Thank you. Thank you to everyone who has logged in today to join our Bean event on microaggressions in the workplace. On behalf of the Bean leadership and our advisory board, we are so excited to bring you a session like this with such a stellar lineup of panelists to guide our discussions today. Kudos really goes to this trifecta of angels who work together to bring you this dynamic discussion. Brande Martin, Jay Mori, Anna Dextra, who've been working together feverishly over the past few weeks to put this all together for you all. And I'm sure everyone will be so excited by it. And the only thing that I wanted to say before turning it over to Brande and Jay Mori is that we look forward to bringing the Bean family up to date in the next couple of weeks. Brande and I are just ironing out some details with HR, but we will be bringing the Bean family an update on the progress that we're making with AMA senior leadership on some of our charter goals that we established together at the outset of the year to achieve for 2020 and 2021. We're making great progress there, and we'll be bringing an update to the group in a few weeks. So without further ado, I'm going to turn it over to Brande and Jay Mori to get you all started.
Thank you all for coming to this event. I am Brande Martin. I'm the co-chair of the Black Employees Allies and Advocates Network, otherwise known as BEAN. And today our session is going to be Courageous Conversations addressing microaggressions in the workplace. And before we launch into the program, just a few quick announcements. As Jay Mori had said, we will be recording this session. We're already recording. And we will ask you to please mute all of your microphones. And throughout the session, we will have different polls that we will ask you to participate in. And if you have any questions about those polls or need any help with that, just put a comment in the chat and we will assist you. And also, the topic that we're going to be focusing on today is one that is very sensitive and can be emotional for many of us who have experienced microaggressions. And so I want to make sure that everybody is respectful of our panelists as well as all of our participants and attendees to this particular session. I would like to begin this program and to situate you in kind of what we're going to talk about today in this Courageous Conversations panel and program is that we're going to talk about the effects of microaggressions. And the microaggressions are intended or unintended insults or slurs in the workplace, and they happen outside of the workplace as well. But in the workplace is where we're going to focus here. And they're mainly targeted toward racial and specific gender groups. It's focused on the different biases that people have towards others who are not like them. And obviously in this panel, we'll get more deep into understanding the microaggressions. And we want you to walk away from this session with a better understanding of microaggressions and overall to have strategies and ways, if you are a person who's experienced it, to be able to cope with it, manage it, and address it. For those who may observe or witness a microaggression, we want you to have some tools that help you to, and strategies that help you to be an ally and to support others who are targets of a microaggression. And then overall, for all of us, we want you to walk away with a better understanding of awareness of our biases so that we can build a better and stronger organization and have better relationships with each other within our workplace. So I would like to now begin introducing those who will participate. First, Mori Johnson is a Bean Advisory Group member, and Mori is going to help in co-facilitating this panel. And I will now introduce our panelists. Our first panelist will be Dorcas Lind. Dorcas is the president and founder of Diversity Health Communications out in New Jersey. And I actually met Dorcas several years ago at a diversity and inclusion AMA-sponsored health equity symposium. And Dorcas specializes in diversity and inclusion trainings, and she's worked with Montefiore health systems, as well as Memorial Sloan Kettering Cancer Center, and helping those organizations and health systems with diversity and inclusion training. Our second panelist is Dr. Nicole Harris-Hollingsworth. She is with the Hackensack Meridian Health out in New Jersey, and she's agreed that it's okay. We will refer to her as Nicole throughout the session. And Nicole has previously worked at Montefiore, and she specializes in the development of community health programs designed to create behavior change and increase knowledge in hard to reach populations. And she's also developed many worksite wellness programs for health systems. And our third panelist is Dr. Carl Lambert, who is with Rush University. He is a family physician, a practicing physician, and he specializes in high blood pressure, men and women's health. And he will help to give us a physician's perspective on how microaggressions affect our health and ways to strategize and work through our mental and emotional well-being as we deal with the microaggressions. So I would like to now really kind of dive in and turn it over to Jay Mori, who is going to show us a video to kind of set the tone for microaggressions and to give a little context. So Mori, I turn it back over to you.
Thank you, Brande, for that. I'm going to let this video speak for itself. If everyone could look in the chat and please text Mori Johnson 593 to telephone number 37607 so you can participate in the poll that will happen right after this video is over. The video is just over 1 minute. So if everybody could activate their phone, and I'll share the video. So anyway, grab your phones. Hopefully you have activated your phone for the next portion of the session because we're going to do a little poll. So these are the polling instructions once again. If you would prefer to do it on the web, it's pollev.com/Mori Johnson 596. And the video that we just looked at is from, I knew it as Procter & Gamble, but I guess they have rebranded themselves P&G, and it's called The Look. And they actually have a whole series of videos tackling systemic racism, bias, and so forth. So you can check out additional videos on that. So the first poll is live. And this one is a single word, or the workaround around a single word is hyphenated. So if everybody could check in with how they're feeling right now. This will also help your 3 panelists in their presentation to you this morning. How do you feel after you've watched this video? And you could submit multiple things. If you want to do more than one word, just put a hyphen in between the words. Exhausted, ashamed, sad, tired, depressed, sympathetic, discouraged, enlightened, emotional, judge, concerned, relatable, anger, sadness, unsurprised, emotional, tired, guilty, outraged, familiar, chills, sadness, depressed, heartbroken, mad, familiar, pissed. So thanks so much for putting your honest, that's the one thing I like about these anonymous polls is, you know, it allows everybody to be brutally honest. I personally have all of these emotions because the look has happened to me all the time, probably on a daily basis. And that look communicates a lot of things, but what it all boils down to sometimes is a look of devalue, a look of not really wanting you there, and it can be very hurtful. So with that, I'm going to lock the poll. If anybody wants to take a screenshot or a picture, now would be the time to do it. I'm going to stop sharing and turn it back over to Brande, who will facilitate our panel discussion.
Thanks, Mori. Yeah, we wanted to show that video because, as you see, there was no language, there was just music and visuals there. And I think that's, like Mori, I too have experienced a lot of what you see in that video, those type of looks. And I want to now begin asking our panelists some series of questions to help us all to address what we just saw in that video, and also to address the feelings that many of you just shared in terms of feeling depressed or angered or exhausted by these type of situations. So let's get started with really, how do we define microaggressions? What is a microaggression? And are there different types of microaggressions? Dorcas, could you start us off in helping to define what a microaggression is?
Okay, great. And good morning, everyone. Thank you for starting off with that video. It's so powerful, and I appreciate that you're encouraging everyone as we talk about this issue this morning to think about both the actual experience and also the emotions. And I think people are uncomfortable to talk about microaggressions because we want to minimize them as much as possible so that we don't feel the discomfort and we don't feel the pain. But in fact, I'm going to take you through a couple of framework ideas for you to think about how microaggressions can actually have a significant impact on how you interact with your teams and within your organization and even externally, so that we have a framework to think about how they work. So we're talking about remarks or looks, as we've noticed in the video, that can actually both either verbally or through language show some kind of affront. And it's something that makes someone uncomfortable, and either we experienced it and we know why, or people observe it and they don't know why. Next slide. And we want to really put some language around it. So we know that microaggressions are verbal or nonverbal and environmental actions that can communicate hostility or derogatory negative messages towards individuals across a number of dimensions of difference. We're focusing right now, particularly because of the larger societal place we find ourselves in, on race, but certainly ethnicity and religion, nationality, sexual orientation, and gender. All of the issues around ability and even socioeconomic status. When we're talking about healthcare and the arena of medicine, there are even more layers that we can go into in terms of how we are different and how we show up in rooms and teams and in academic and clinical environments together. And while they may not be intentionally hurtful, they end up being insulting and can make people feel devalued. And we're going to talk about how that can increase over time. Next slide. I like to share the analogy of from the tech world, which is when you, let's say you have your cell phone and there is a water dripping on your cell phone and a water drop. You get irritated and you wipe the drop away. And it's no big deal, right? It doesn't affect your ability to use your technology. It doesn't affect your technology itself. But if the water continues to drip and you get to a point where your technology is now in a puddle, something happens to that technology in terms of its functionality and its ability to actually perform the way it needs to perform. So we're going to talk about how microaggressions over time can actually have some very negative impacts. So it's important that we think about intent versus how it's experienced. It's important that we think about how the individual is actually impacted and how individuals who actually make the statement or behavior, how it affects them in terms of how they respond to when an individual experiences the impact of a microaggression. So the harmful impacts can really be far-reaching in terms of both the immediate response and how people are able to continue in the discussion or teamwork or decision-making, but it also has physical implications as well, and they can range from anxiety, diminished confidence, especially when one commits a microaggression in the presence of others on a team or in a meeting. It can have something called intrusive cognitions, which is really powerful in the sense that it can make people start to doubt themselves in terms of their own assessment of their belief about themselves versus what others are projecting upon them. And a sense of helplessness. And we talked about the sense of worthlessness earlier. Next slide. So in terms of the impact on the workplace, we really want to get away from the thinking of, oh, you're being oversensitive. It's actually not a big deal. It actually has some very significant negative impacts in terms of the climate of a team or workplace. And it really gets into incentives around how people engage in their work, whether or not they are committed to being retained as part of a team or part of their job. And it speaks to ultimately how employees can become disengaged in their work and decreased productivity. So it's not just about, although that's equally important, the emotional impact and the sense of discomfort, but it truly has some significant workplace productivity impact that we want to be able to overcome so that as people commit microaggressions and experience them, there are ways that we can start talking about it in terms of how to solve around this challenge. So here are a couple of ways of thinking about how microaggressions show up in behaviors, attitudes, and beliefs. So the first is bias, and that's people sharing opinions that they hold, and they typically are judgments or reactions that they don't question because it's part of how they have grown up in their own cultural view, in their own worldview. Stereotype is part of that, how biases come about in terms of the set of beliefs that people have based on their group membership and how they think of outsiders. Prejudice is also a way of how microaggressions come up in terms of either conscious or unconscious negative attitudes about in-group and out-group, in terms of how you identify yourself with the individual that's experiencing or delivering the microaggression. And then discrimination and favoritism in terms of how people protect or do not protect those that they consider part of their group. So what does this look like? How does it show up in our language? These are statements that probably you've heard in different configurations, but people will say, some of my closest friends are gay. What do you mean? In a very defensive way. Oh, I don't think of you as a follow-up to a microaggression that's been stated. This is very common in the medical and clinical arena. Public colleges produce some good researchers, but some often said in a way of dismissiveness in that they're not part of the elite organizations. We are all part of the same race, the human race. You know, why do we have to look at these minor issues and statements? And then finally, we know at a very heavily spotlighted issue right now, the comment, all lives matter, which has become very politicized. And, you know, there's quite a bit of controversy over how that statement is used in terms of a societal level microaggression as far as what we're facing now in social justice issues. Next slide. And then finally, I just want to give some construct for us to think about certain themes that come up. So for example, if you hear the statement, and this is one that I have experienced very often throughout the decades of my life, where are you really from? It's this notion of being an alien in one's own land. So the message there is you aren't really American. And so I share with Dr. Hollingsworth, being a native Bronx girl, and I often, no matter where I am in the world, say that I'm from the Bronx, and I feel very proud about that. But I have been asked that question on so many occasions that really speak to whether or not I am a Nuyorican, whether or not my Hispanic heritage is legitimate, if I really am an immigrant and I'm trying to hide my status, a whole complexity of challenges to my national identity comes up with that. Another example, ascription of intelligence. You are so articulate. So this is very complex because when people hear this, they get very defensive and they say, so I'm not allowed to compliment someone when they're intelligent and they speak very cogently and clearly and effectively about a particular topic. And there is a plethora of research that shows how the term articulate, when used with, in particular, African Americans across every industry, how loaded and complex that statement is. And it's the messaging there is, it is unusual for someone of your race to be intelligent in this way. So I won't go through all the rest of them, but the comments are, when I look at you, I don't see color. Are we actually denying a person's true, authentic reality? My best friend is Black, or as a woman, I know what you go through. So it's trying to compare and minimize difference in terms of the strength of the microaggression and the impact that it has. And so within that structure, I think that we can have a very open conversation about how some of these statements or similar statements show up as we work on teams, as we work with our leaders within organizations, and how they show up in terms of hierarchy within medicine in particular, because they can be very powerful in the clinical setting.
Dorcas, thank you so much for that thorough description about microaggressions and the different ways in which those microaggressions can be, you know, how they can affect employees in the workplace with, you know, it creates self-doubt, looking at the concept of people saying, oh, you're just being too sensitive. I think we've all heard that when we've felt insulted or tried to address that microaggression where it's like, oh, we didn't really mean it. You're being too sensitive to that. And it really does weigh on your emotional and mental well-being when you receive and hear these type of, you know, derogatory and minimalizing comments. Nicole, would you speak a bit more about, Dorcas, you kind of touched on it in terms of like your own ethnicity and the mixture of biculturalism and intersectionalities that many of us have. And so Nicole, could you address that and define for us like biculturalism, intersectionality, and talk a little bit more about explicit and implicit biases that we may encounter? You're still on mute.
Great.
There we are.
Oh, there we go. Hi, everyone. Thank you guys for sharing this space with me. Dorcas, fabulous as always. But literally, as you were talking, I kept like writing down in big letters, like intersectionality, intersectionality. Because as you look at microaggressions in any workplace, and while I know your collective is a unique workplace, it's a reflection of the larger environment in which we all live in. And so I just want to sort of expand a bit on some of the points that Dorcas made, specifically around micro assaults, micro insults, and micro invalidation, and then talk a bit about how there's an intersectional component to that as well. So as Dorcas explained earlier, you know, micro insults are things that are uniquely perceived as offensive, but there's a determination factor that where someone actually has to sort of figure out, like, did this actually happen to me? There's an evaluation factor. You're looking at it, am I being sensitive? Am I being sensitive to the environment that I'm looking in? Or did something actually happen? And more often than not, you're not oversensitive to an environment. Something has occurred. It's really about categorizing and better understanding what that looks like for you and what that means to you and what, if anything, you need to do about it. And so once there's that feeling of insult, some level of offense, you know, sort of the next determination that one has to make is, you know, is it a micro assault? So you can be insulted, but then like, is it an assault? You know, was there a specific event, a name calling, an overt event that occurred? Sometimes the perception is, well, no, like this wasn't something overt. Someone, I think they looked at me in a certain way, you know, akin to the video. And if I tried to explain this to someone, would it make sense? And doesn't mean that that wasn't wrong, but there's still an evaluation factor that needs to happen there. But really the key, I find, is really around the micro invalidation. And this is the perception of feeling of value related to whatever the experience it is that you've had. So if something occurs and you perceive it as offensive, and then you go through this experience of trying to figure out, were you truly assaulted? And again, this is a self-determination. Where it lines up as a microaggression is really around the perception of value. Did you feel devalued or ignored or delegitimized in a certain way? And when you're able to line all of those things up cognitively, to be able to own within your perception of this experience that something happened, then yes, you know, it falls under this sort of broad label of microaggression. And so then the determination has to be made, okay, well, what, if anything, can be done about this? The challenge, and I say this coming from the framework as a woman of African ancestry of the American South, is that so many of these things are intersectional. And so there are times when I'm trying to figure out, am I feeling these invalidations and insults and assaults because of my race and ethnicity? Or am I feeling them because of my gender? So it may not, you may be completely fine with my ethnic group, but you just don't like women, or you just don't like Northerners, or you just don't like New Yorkers or Bronx girls, or whatever that intersection is. And as I dig deep into those things, and as I work and coach others to dig deeply into these things, so often there's a stop at the place of race, because so much of the national language has been focused around race, and we leave out the overlays of all of the things that are intersected with race. So when we look at ability or disability, there are invisible disabilities. So if you are not present because of and either physically or psychologically present because of what is perceived as or known or felt as an individual disability, how is that perceived? And this in many ways can overlay very heavily with gender. I'm going to presume that since we're all from people, that we all know pregnant people, and I'm going to presume someone has been pregnant inside of your organization. How do we engage with someone who is pregnant? How do we engage with that person who is culturally who is pregnant? What are the intersections of microaggression that occurs there? Oh, and I'm going to use some made up names. So if it's actually someone on your department, I'm so sorry. But Michelle can't do this project because she's pregnant, and so she's not going to be here, for whatever extended period of time. Oh, I don't, well, women who are pregnant in one ethnic identity are different than others of another ethnic identity. When we look, again, another intersectional factor, when we look at places of origin, as Dorcas mentioned, there are lots of people who get this, where are you really from? But what's even, more amazing, being and sitting within an ethnic group, are the microaggressions that occur intragroup. So the colorism that occurs intragroup, the notion that people from across a broad ethnic diaspora, for which there is a tremendous amount of ethnic mixing, can feel one way or another. Gender and gender identity is another point of intersectionality, which is an issue. There's an old saying, when someone tells you what country they're from, it's, you may sort of question a little bit, because you may not know where that is on a map, because traditionally Americans are bad at geography. But for the most part, if someone tells you I'm from Jamaica, you don't go, no, you're not. You look like you're from Brazil. You'll pretty much accept that. But when it comes to gender and gender identity, we don't accept those labels. And that is often it's not often, it is a microaggression. Actually, I consider that a macroaggression. When someone tells you who they are, they tell you what their pronouns are. They tell you how they would like themselves or their culture to be expressed. And so again, these are not isolated instances where you can make these broad blanket statements and go, well, I have no problems with someone of an ethnic group, yet refuse to address their gender, ethnic, ability, or origin identities. And so this is a lot of talk to go, okay, great, but what do you do about this, and how do you measure this? Because in the multiple workplaces that I've been in, while I've accepted the challenge of coming up and saying, okay, this happened to me, this was my experience, and I didn't like it. And inevitably, I'm asked the question, how do you know that's not just a feeling? How do you prove it? And so I've spent a lot of time looking at how do you evaluate, and how do companies evaluate what does this look like? What is the perception and the temperature of their workplace? And so while, there's never going to be a survey that someone fills out that says, I committed 15 microaggressions in this week, what can be done and what has been developed is something called the Racial Microaggression Scale by Dr. Torres Harding, ironically out of Roosevelt University there in Chicago. And what you'll be able, and I'll definitely share the link to the survey with your counterpart team, but it's a 35-item scale that's essentially a temperature taking of individuals who feel that they fall within categories for which microaggressions can fall, which technically means everyone gets to take it. But assessed across a corporate landscape, what you would be able to see is essentially effectively, what is the temperature of our organization? And so without going deep into the weeds of heavy research, the main 6 factors that they find when looking at these evaluations are that, either there are high reports of invisibility, high affiliations or associations with criminality, affiliations with being either low achieving or undesirable, being highly sexualized, being foreign of some type, or issues related to disability or ability. And so when you look at those factors, because so much of this is about, it's great to know, and I'm all for knowing, but it's more about like, what do we do? And so organizationally, to the extent to which we're able to take our temperature, understand where we're seeing the microaggressions occur, and then provide information, support, resources, and education comprehensively, not to just the impacted group, but to everyone. That is where they and others have been able to see an effective change. And so I'm going to wrap up with one of sort of my favorite quotes, which is Constance Baker Rice, who very consistently was very much like, I reject the notion that I will be defined by my sex or my race. And so much of this within a professional environment is around perception of self. Microaggressions do occur. Unfortunately, there's not going to be a magic wand that's going to stop them from occurring. But at a certain point, even in addressing them, there has to be a level of self-efficacy to say, what I'm hearing about myself, what I'm perceiving about myself is not who I am. A rejection of this projected identity as yourself. There needs to be a rejection of that, a clear understanding of who you are, and then an advancement of how to change that. And so to the extent to which, yes, you can take the temperature of the organization and also the temperature of yourself to understand how to better challenge people, and then to have good efficacy around who you are truly, what you believe in, and how to move forward. It will allow a level of armoring that is protective and defensive against the microaggressions that one may occur, but still allow you to both advance and continue to grow within your workplace.
Thank you, Nicole. That was really helpful to get some tips about how you can actually measure the temperature of the microaggressions that are occurring. So I think, as you said, you'll add that link for us about that racial and microaggression scale. And I think, as you've also talked about, kind of the micro and macroaggressions that people experience. And I think you and Dorcas both have given some examples of, things you've encountered. And Carl, we'd like to hear an example from you of either microaggressions that you have personally faced, because I think as more people become aware of examples, it helps them to recognize if they are actually have committed it, microaggression, and also understanding better the different ways that we're affected by these things. So Carl, if you could speak to maybe a personal experience that you have had with microaggressions and how you handled that, it could help our attendees.
Sure, can everyone hear me okay? Hear me
Yes.
well? Yeah, thank you so much for letting me be here, and thank you to my previous panelists. I'm sitting here taking copious notes and feeling a lot of things. It's a little difficult to actually share these things. A lot of times I feel like I push them aside, just full transparency. It's hard to talk about these things. So when I was posed that question, I actually thought of different examples at different levels of my training. So I wanted to go about it that way. So I went to Rush for medical school, and fun fact, at that time I was the only African-American student in my class of 140 so students. So just that feeling of isolation was tough. But then just some of the examples of microaggressions and macroaggressions that first came to mind were having derogatory terms or phrases from classmates or even teachers that said that I had an edge in the selection process because I was of X race, even though I was the only student of that race that was selected. Another one, which was already mentioned previously, is during my clinical rotations, I would often hear, "You speak so well for a Black man," right? So again, sometimes with microaggressions, it's almost like a kind gesture, but it's also mixed with almost like an underhanded comment. I also thought about a time when I was a resident. I was a senior resident doing my OB-GYN rotation, so we were doing labor and delivery. And I was with a student who was a white female student, and I entered into a room of a laboring patient, and the family assumed immediately that she was the physician that was in charge, and I was the student, when really was the reverse. I was training her. There's been other times when I've gone into examination rooms in the hospital, and I was asked if I'm here to pick up the food or put the trash away, when really I have my whole white coat on, my label that says physician, and yet I'm still getting confused in a way that I don't think would actually occur if I were, for example, a white male, okay? There are other times when I was a student where I would round with a team, like an interdisciplinary team caring for patients, and I would hear comments disparaging a patient, assuming that maybe they used drugs or that they didn't care about their own health, and completely ignoring that there's likely social determinants of health and lack of access to care that's causing these patients to actually come into the hospital and seek our care. That it's not a lack of caring, but there's actually structural barriers that are in place. And then I remember my first year in practice out in the south suburbs in Harvey, Illinois. I had a older white female patient who was establishing care. And at first the encounter seemed really innocuous, but as I went along, it felt almost like a job interview. So very different from establishing rapport with a patient where you talk, back and forth, but it was literally a litany of questions that really the root was, are you capable of being a physician, or how did you get here? And do you even know the basics of, a physical exam? Like, do you know how to listen to a heart, or have you ever heard of the thyroid gland? So, and then the final example I'll share, which was almost vicarious, and this is most recent, is that one of my medical students brought to my attention an article that was written by the Journal of the American Heart Association that's been redacted, but it crafted a paper that argued against affirmative action initiatives in the field of medicine and blatantly stated that Black and Hispanic trainees were less qualified than their white and Asian counterparts. So those are just a few of the examples that I have, but there's no doubt there's a litany of them out there. And I share that really to just tie in how these aggressions affect us, right? So there's various ways. So it can affect you physically and psychologically and physiologically. So when I think about that, I think about what's called racial-based traumatic stress. So that's really like the mental and emotional injury that's caused by encounters with racial bias and ethnic discrimination, racism, or hate crimes, or living in a racist society or system. And then those stressors can be individualized, they can be within a system, they can be directly affected or directly addressed to you, or vicariously experienced or even transmitted from one generation to the next. The point I'm trying to make is that they have long-lasting tolls, that I've experienced that, and many of my colleagues have experienced that, and it just makes me think about just 3 different tiers that I wanted to share. So the first is physiological. I liken the symptoms feeling like you are making things up as you go along and you're constantly having to prove yourself. So if you add racial stress on top of imposter syndrome, it can make it really hard to cope and give your best at work, whether that's with patients or with your students. It can cause you to shrink and be less engaged. And you often feel like you have to walk a line of being this consummate professional without being perceived as an angry Black person, when really you're often just trying to advocate for yourself. And additionally, These things play a part systemically because if we don't have a diverse healthcare workforce, that leads to direct patient outcomes. So there's a loss of cultural competency where you lose patient and provider connections. There can harbor increased distrust in the medical establishment, and that lends to the development of healthcare disparities, where there's glaring differences in terms of outcomes, a variety of things between groups. I think I saw in the chat that there was a question that addressed that. So I think literally any quality metric you can think of, hypertension, birth rates, adverse outcomes during childbirth, there are differences between, you know, African Americans and white patients that are very concerning, and some of them, it's still present even if you consider socioeconomic status. And some of that is even trickled into medical education. For instance, there was literature that was, you know, many years ago shared to schools that Black people had higher pain tolerances and that they did not need the same level as pain medicines as white counterparts, or so that sort of notion and thinking process adversely affects how we care for patients, if we take their concerns seriously or not, and if we even think about the backdrop of how our patients come to us. If they come from communities that don't have the same level of resources, we need to be aware of that so that we give the patients and communities the right treatment that they need at the right time, every single time.
Carl, thank you so much for being honest and open and vulnerable to share your experiences. I think it's very enlightening for a lot of people who just don't recognize that the slights that they make, unintentionally sometimes, are very detrimental to our health and well-being. And, you know, imposter syndrome is something I think within a corporate environment in particular that can begin to happen as somebody is feeling as the only in a room, and it starts to erode your confidence, even though you've put in all the hard work, gone to school, and you've achieved at a certain level, but then the biases of others are causing them to doubt your expertise based on your race or, you know, your gender. And so I think it will be useful to understand some ways in which you as the target can work towards moving beyond this or addressing the person who has offended you or slighted you. And Dorcas, could you talk to some ways that a person who's a target can move beyond this and to thrive? And if you could just, you know, give us a few examples or tips.
Sure, and we'll revisit the slides again so that we can look at examples of sets of language and types of questions that can be asked. But I do want to just build on something that Carl mentioned, which was that comment about you speak so well, that he experienced. And, you know, it's that sense of exceptionalism that is placed upon people that actually erodes even the relationship of that individual with their own group. So I know in my own upbringing in high school and even in, you know, secondary education and on, every time when I was young and formulating my identity as an educator, as someone who was a team builder and a team leader, it really eroded my sense of connection to my own community when people made comments like that. And that really gets in the way, particularly in the public health arena, when the very people that you are trying to most help, you're constantly being told you are so different from. And I think that it's a cycle and an experience that many of us who are people of color have to overcome in terms of being part of those educational systems and those corporate or academic systems and clinical systems that really have an environment that can, without intentionally trying, really try to other us even within our own groups. So let's talk about confronting. And I've seen a lot of chat comments come up about, so how do you do this? Because it really, when you talk about the physiological experience, so you're feeling outraged or pissed. You don't want to acknowledge that maybe I'm just overreacting. Maybe I'm being extra sensitive because of other issues. But you're still feeling all of these experiences, and you want to have the opportunity to clarify, was this an intentional comment, or maybe the individual making the statement didn't truly intend that, but it's an opportunity for them to learn what they actually, how they impacted you personally, right? So what are you trying to accomplish when you think about confronting a microaggression? And then what's your relationship to the perpetrator and the bystander? How do we manage that interaction and that power analysis as we're in the moment? Next slide. So we talked about the intense anxiety and fear of offending, of not knowing enough about the subject to actually be informed to change someone's opinion or influence them. You're concerned about conflict that may arise. Perhaps it's triggering a memory of a negative outcome from a previous dialogue. You're concerned that you will be judged by that individual or by their colleagues. The bottom line is you just feel the other person won't get it, and it's not worth the high stakes of what that means if you actually confront them, or the possibility of becoming emotional on the spot, showing anger or breaking out into tears, for example. All of these are very real experiences that can occur simultaneously as you're trying to decide, do I want to confront this or not? Next slide. So it's important to actually have some language in your back pocket so that you can be prepared when you're confronted with a microaggression, and give you the tools to be able to mitigate some of that tension as you're trying to have a dialogue that comes from a place of empathy and humility, as opposed to some of the negative immediate reactions that you might have. So yourself as someone who may experience the microaggression, and the individual who delivered the microaggression, to really step away from kind of that tense moment of realization that something may have happened that has made someone uncomfortable, and being able to separate the intent of what was said versus the impact. So an example of how that could be handled is, I know you didn't realize this, but when you, and that could be made that statement or gave me that look in the meeting, comment or behavior, it was hurtful and offensive because, and then you have the opportunity to explain why. And then if you're feeling comfortable to continue it, you can actually offer a change in behavior. Instead, you could have X, Y, and Z done, or ask something differently. And then the third piece is share your own process. So you can use language suggesting, I noticed that you did or said a comment or behavior. I used to do and say that too, but then I learned. So this is somebody who is serving as an upstander in the organization or on a team, as opposed to a bystander who just watches but doesn't intervene in any way. And that actually gives folks the ability to be role models for others when they are able to step up in that kind of a courageous way. And then if you find yourself in a situation where you've been approached with a concern about a microaggression that may have happened external to your individual situation, a couple of things that can be done that really do help support the individual who has experienced the microaggression, but also potentially lead to supporting intervention with the person who delivered the microaggression. So listening to the person's concerns, you know, probing as to whether or not jokes or comments actually have an impact on someone else's pain or emotional experience. Being able to verbally acknowledge that the feelings are valid in terms of making sure that intention versus impact is understood, and that negative impact needs to be addressed irrespective of the intention. Apologize and move on. The apology can be very powerful. So I can share with you in a clinical setting, I was partnering with clinicians who were working with primarily Hispanic population of mothers. And as part of the research protocol, one of the questions which is typically asked is, are you married? And this is important for several reasons, based on whatever types of interventions or support or access to resources would be made available to these moms. But the fact of the matter is, from a cultural competency perspective, many of these moms were not only married, but also Catholic, and were deeply offended at being in a clinical setting with the individual physician knowing that they had numerous children, asking them if they were married or not. They took it as a tremendous insult in terms of their status as mothers. And so what they found in that situation is the easiest and most effective way of rebuilding trust, because that's a very significant clinical example of how a microaggression can actually deplete the relationship between provider and patient, is an apology and an explanation of, that's not what my intention was, and let me help you understand why this information is important. And you're able to move on in terms of what you're really there focusing on. And then overall, a commitment to doing better. Reading material for the individual who has been told they've committed a microaggression to someone else. Getting more information about types of phrases and comments that have deep historical context. And there are two resources that I also want to share, which is, the first one is a wonderful book by Mary Frances Winters called We Can't Talk About That at Work. And she gives some wonderful examples of race and religion and politics, and how microaggressions come up very often within those themes in the workplace, and individuals can really get some support around that. And the other piece that I think is really, really helpful is a recent book, and I will share that in the notes as well, in the chat. And that is a reframing of actually moving away from the term microaggressions, because it's so loaded in terms of it feels aggressive, it feels potentially violent when you're talking about language and behavior. And so this group of authors talks about reframing it to acts of exclusion. And so talking about it in that way, so that you can start thinking about how you create more inclusive environments that move away from these very specific acts that actually work to exclude, as opposed to bringing individuals together. And I'm getting that information for you right now as we chat.
Okay, great. Nicole, Dorcas, touched on some ways that the person who has been a target of a microaggression is affected, and how to actually handle it, as well as talking about the bystander or ally and how they can help, as well as that person who's committed that microaggression. Can you add to any of those areas in terms of ways that either the bystander, the target or the person who's committed the microaggression can move forward and to thrive, to create more inclusive environments?
Sure, and thank you. Yeah, I noticed in the chat that a version of that question had come up, essentially like, you know, is it healthy to withhold your feelings when these kinds of things occur? And when you look at the roles that you just mentioned, the role of the bystander, like if it wasn't you and you're just seeing this happen, what responsibility do you have in this process? Well, as a bystander, you have two responsibilities. One is actually an acknowledgement of the individual who is impacted, because oftentimes there is, in the midst of these circumstances, sort of a seeking of external validation, like, especially if someone else is around, did someone else see this happen to me? And being able to acknowledge with the person that, yes, this did happen to you. You know, I saw it, I heard it, I can affirm the interaction, and I'm potentially even willing to discuss with you what that is. That may be a step too far, but part of it is the acknowledgement, at least the verbal, the companionship of presence around that this incident occurred. To the extent, and yeah, I think Dorcas did a really good job of this, but to the extent to which you can engage in, you know, the sharing of experience around appropriate engagements in experience, i.e. if someone has, if you are the bystander to an incident, being able to have a discussion with the perpetrator around what could be, or what could have been the right way to address that situation and what future direction should look like. More often than not, that is not going to occur in the moment. So there are times when, and I as a bystander have witnessed this experience where I see an interaction occur with someone and I'm like, that wasn't right. Like I saw the interaction, it wasn't right. I needed to stand in presence with the person to be like, yes, I did see, like I saw that thing happen too. But I also, especially, and this may be positional, with junior staff, needed to inform them like, you know, I'm gonna have a conversation about it, but you're not gonna be at that conversation. Because it is not so much a demonstration or proving to you of like, oh, I'm going to castigate this person in front of you. We're not trying to set up those dynamics. But in this, so much of it is around the learning. And you know, the idea around microaggressions, as Dorcas explained, is that oftentimes the perpetrator of the microaggression is not necessarily aware that they have perpetrated an aggression. And so it does require a conversation. It does require supplemental education. It does require information. And those are some of the roles of the bystander. For the person who is, you know, the recipient of the microaggression or of the aggression, there really does need to be a determination. And I think everyone handles this one a little bit differently. So I'd welcome the perspectives of my fellow panelists around sort of what do you do when this happens? And so very similar to, you know, the video that we saw on the look, many communities, whether or not they're a community of color or gender identified community, have something that's called the talk, where, you know, there are going to be things that are going to happen in life that are untoward. And it's a pre-preparation around, well, what do you do about this thing? What are the ways in which you handle and manage this circumstance? And so whether or not it's, you know, the prevarication of having, you know, sort of preloaded language around, oh, well, when this happens, how do I ask? How do I engage? How do I ask the right question to get you to see what either you said was inappropriate, or how do I give you that suggestion to inform you that what you said was inappropriate and this is something that you should say instead? That is something very real, but unfortunately, and I'm going to say very plainly, for many individuals who are the onlys or Black, Indigenous, and persons of color in environments, more often than not, you are first. And in being first, there is, I'm just going to speak super plainly here, there's an unfortunate burden. It's unfortunate, but it is realistic that you're going to be in the room when someone creates a microaggression. And you may not be able to have that conversation in that moment. That is just very real. I don't know who the spectrum of people are on this call, but I don't, if you walk, like if I were in the White House right now and the president said any of the things that the president says, it may not be in my personal best interest at that moment to express any of the things I may be feeling at that moment, in that moment. And acknowledgement and awareness of what are the moments and what are the processing and what are the procedures to be able to do becomes incredibly important. And lastly, what I'll say to this for both a bystander and the person who's impacted by this, this is where the power of policy comes into play. Because we are working in institutions, we are working within structures, and you have to ask yourself, okay, great, well, what does my HR policy say about microaggressions? Is there a policy about it at all? And if not, then what responsibility do I have toward helping to create the systemic solutions to the issues that I encounter? There are times when it may be like, oh, well, we're going to get a group together and we're going to be reinforcing, or we're going to create a mentorship or sponsorship program, and that's going to be reinforcing. But the additional step may be that, we need to create some policy around that and have that brought into the structure. We may need to create some reinforcement around that, and whether or not the reinforcement is, regular discussions around challenging issues, of which this would be one. Large companies have all sorts. It may be around enhancing cultural receptiveness and responsiveness. I don't believe in cultural competency. No one ever gets anyone else's culture right, but you can be responsive and receptive to what's there. But that may be a process. And unfortunately, some of this work may be on the impacted community. So it may be that the impacted community has to take these extra steps in order to make this happen. But there isn't the luxury of being able to say, well, this is how the world should work. And have it work that way. There is work required in this process, but whether or not you're a bystander, caring supporter, ally, or impacted person, you do have a responsibility.
Thank you, Nicole. So we're at time for our panel discussion, and I want to thank you, all of our panelists, for the great information that you've provided us with to really help to define microaggressions and to give us some strategies as to how to address these from the different roles that you may play. We want to have time for Q&A, but I'm going to turn it over to Mori right now, and she's going to show a video, and we're going to do a closing poll just to kind of give a different perspective about microaggressions, and then we will open it up to questions.
Awesome, thank you, Brande. I'm actually, because of time, I probably won't show the whole video. I'd like to call this flipping the script. I think sometimes in order to really get something, you have to see it in reverse, because when you see it in reverse, it's just a different perspective. So satire does a lot of this. And so I just wanted to share this clip about microaggressions if it were in reverse. And again, we're not doing this in any way to disparage, but truly to educate and have you look at this from a different angle.
So you're not good at golf, but you're white. People of color have to deal with racial microaggressions every single day. So microaggressions are those little unintentional insults that basically see people of color as stereotypes, which got me thinking, what if white people had to deal with racial microaggressions?
So where are you from?
No, where are you really from?
Why don't you have an accent? Like a Swedish accent.
You know, your English is really, really good. It's like I can't even tell you have an accent or anything.
I don't have an accent.
No, that's what I'm saying.
You don't speak Gaelic?
You don't speak German?
Can you say a curse word in European?
You know, like, what does that even mean?
Hey Connor, you know about NASCAR stuff, right? Can you take a look at this?
Can you teach me how to line dance?
Play the banjo?
Act entitled in the supermarket.
I love white food. No real flavor to it. Never an upset tummy.
You're so exotic.
How do you get your hair like that? I love how it's so limp.
Ew, why does it feel like that? Oh my God, so it just does that?
No, you are really pretty for a white girl.
Your eyes are so round, like this.
You know who you look like? Kenny Chesney.
Zach Braff.
Emma Stone.
Rachel Maddow.
My friend Chad. Maybe you know him, because he's white too.
No, Emma Watson.
Not Macklemore. What's the other guy?
No, is it Emma Thompson?
It's C-H-A-D, like Chad.
One of the Emmas. You look like an Emma.
You know who you look like? I bet you hear this all the time. Jeffrey Dahmer.
How does it feel to be the token white guy in the office?
Hey, Connor, can we get a white perspective on this?
I love everything about white culture. You guys are like so fun.
What do you mean you don't listen to Creed? You're white.
You've never tried math. But you're white.
You don't act like a normal white person.
You're not really white, though.
You're not really white.
I'm whiter than you are.
So, did all your ancestors own slaves?
No, but of course he wishes that he could still own slaves. That's a part of his culture.
Bryce, back me up on this one. The thing you have to understand about white culture
No, I
is
went
that
to
white
an
people are...
historically white college, so
Okay,
I know about
but I
white culture.
backpacked
Okay, it
in
was a
Europe.
mess.
So can you say how ridiculous this was? I know. Story of my life. If you've ever experienced microaggressions because of your race, gender, sexuality, or body type, go ahead and vent about it in the comments.
Can you teach me how to, like, take a really popular rap song and, like, make it a ukulele song? That's so cool. I think it's so cool how you guys do that.
So again, we're hoping that by flipping the script, it makes our point even more evident in a very funny way, that when you hear it the other way around, you kind of get the message of how hurtful and how stereotypical microaggressions can actually be. So grab your phone. Here we go with our second to the last poll. Please type in one word or hyphenate. How do you feel about microaggressions now after watching that video? So your phones are already set up for the poll. You don't have to resend Mori Johnson 593. If you already did that, you can just go ahead and text to 3706. Ridiculous, sad, informed. Ridiculous seems to be the popular word. More aware, prepare to respond. Intentional, empowered, enlightened, embarrassed, sad, disturbed, ready. Awesome. Thank you so much for your honesty with this. Hopeful, more prepared, cognizant, pissed. So really interesting. A lot of similar words from the first video, The Look. Awesome. So thank you for participating in that poll. We're going to move along to Q&A. Some of your questions have been answered during the presentation, but I'm going to turn it over to Anna to read the questions that have been submitted that have not been answered.
Hello all. So again, feel free to leverage the chat box if you have any other pressing questions that we can hopefully answer in this last 10 minutes. But one of the questions that's come in is, how do you recognize when you're unwittingly committing microaggressions?
I'll take that one. People actually will stop talking with you. They will stop engaging with you, and the nature of your conversations will become potentially restricted to the topics for which your work involved, and very little else. That's one. I mean, there are many ways, but that is one way. You know, the frequent perpetrator tends to end up isolated by action, because the potential person who's impacted just doesn't want to deal with that. So the nature of the relationship will often change.
Dorcas or Carl, would you like to add to that?
Anna, the next one.
Dorcas, you're on mute.
Oh, sorry.
It's okay.
Yeah, I totally agree with Nicole in that, you know, once that trust starts to erode in terms of where the person is coming from and as how they relate to you and how they see you within the construct of the relationship or the team, you notice that there's kind of a withdrawal because there has to be protection in order to be able to continue to show up and do your work.
Anna, could we have the next one?
Yes, you can. Someone said you talked a bit about emotional impact and workplace slash productivity impact. I'm wondering about the physical slash health impact for people of color, because we have research on the weathering impact on Black women, wondering if slash how this impacts people of color, regardless of education, finances, etc.
Awesome question. Could Carl start out with a response to that? And I would love to hear Nicole and Dorcas also chime in.
Sure. I think I touched on that one a little bit earlier. So I think what happens is that there's this cumulative effect that you see in populations that's really rooted in microaggressions. So if we have a primary care or a medical workforce that is not fully capable of meeting patients where they are, or if we come with assumptions that can negatively impact a population, you see that played out in health outcomes. So, and again, that could be from life expectancy, that could be birthing outcomes, that could be how certain medications that are even available to certain patient populations. It plays out in a myriad of ways in healthcare, but I think it really comes down to these basic concepts of do we really care about our patients? Are we using the right language? Are we, I won't even say culturally competent anymore, but are we culturally responsive to the patient that's right in front of us? So, I mean, it starts with individuals, but it plays out very quickly as far as populations are concerned. So it seems like a very innocuous or small thing, but it has very grand outcomes in the grand scheme of things.
Right. Carl, I think that's great. I just want to expand that to also an awareness of the environment that is happening as these things are happening. There was a very popular meme, I want to say about 4 weeks ago on Facebook and Instagram, where people were essentially like, you know, your Black friends are not okay right now. And it happened, you know, amidst, you know, all of the protests and, you know, the responses. And, you know, you could have literally been the perfect coworker, but the larger environment around, the cultural environment around someone has a tremendous impact on that weathering. It's not just the workplace, it's the life experience around that. And so that's just something else to be mindful of, that again, it's not just the tone of an environment, but it's the tone of the culture around that environment and your reaction to that. So it's not just, you know, oh, well, yeah, I know there's this thing happening, you know, out in the distance, but is there any awareness or acknowledgement of that? It can make a really big difference.
And I would just say, I really appreciate those examples of how the macro environment impacts how we walk through the door when we are entering our workplaces. The kind of population impact is so powerful. And I can just share one example of the individual impact in terms of how I physically shut down in my ability to perform. And that is in one place of work many, many years ago, all of the senior leaders, in particular one, would come and make a big deal about how, oh, Dorcas, you're Spanish. You should go to this pitch because, you know, they'll relate to you. And I would have to say, you know, actually, I'm not from Spain. And English is my native tongue. So I actually wouldn't be able to do the kind of connections that you're implying based on those two things. And the individual continuously made reference to the fact that I was Spanish and that I would be a great person to put in front of whatever pitch. And it got to a point where I felt so unheard and so invalidated that I actually lost my ability to speak in meetings and really physically shut down in a way that impacted my performance. And it was very informative for me to have gone through that painful experience, because it taught me to what Nicole was referencing earlier, which is how significant it is for self-care, and to have a community of colleagues and friends and a support group like this group that you all are part of here, to be able to share, hey, this experience occurred and I need a sounding board. I need a self-check. You know, can I share this with you? Because that self-care piece is important. And in that environment, it wasn't appropriate for me for many reasons to actually call that person out, even though I had tried to on my own. But we have to focus on the self-care when we don't get that validation from the individual who's perpetrating.
Thanks, Dorcas. We are running out of time. I feel like we could have probably like a 3-hour session on microaggressions. And I want to thank everybody, particularly our panelists, for taking the time out of your busy days to join us. And thanks for all of the attendees who have come, as well as the different questions that you have recently just posed in the chat. What we will do is we'll continue to compile those questions, give them to our panelists, and then be able to share with everyone that information. And also, you know, we have plans of, Bean has plans of working with our panelists again to perhaps plan a part 2. So we can continue discussing microaggressions and digging even deeper so that we can build better relationships. I want to thank Stephanie, Mori, and Anna also for helping in facilitating the panel as well. So Mori, do you have any parting words? And I know there's a poll that she's conducting right now.
Yes, thank you, Brande, and thank you so much for chairing the Bean and being so supportive of these out-of-the-box sessions, which are not so out of the box for Bean members, but being able to share this with our allies is really powerful, and I applaud your leadership. Our panelists, I don't think we could have assembled a better panel. I don't know how we could ever top this one, because all of you brought yourselves, your full selves to the presentation. And that's really the bottom line here. Key takeaway is make sure you speak out for your fellow coworkers who may not be able to bring their full selves to the workplace. You know, Dorcas, what you said really, really resonated with me regarding you know, multiple times when you are devalued, multiple times when you are not heard, that can manifest in shutting down. And that really, really resonated with me, because that happens to me on a regular basis, unfortunately. A lot of people think I'm very outspoken and strong and aggressive at times, but you know, it's literally death by 1,000 razor blade cuts. It's never one thing that makes you shut down or makes you not perform your best. It's the accumulation of hundreds and thousands of slights and cuts and looks and being non-verbally told that you're not valued. That takes a toll over many, many years. So now that we know better, we can do better. And with that, please participate in the poll. I'm going to leave it up for 60 more seconds. Please give us a rating. Please be honest, because we definitely want to know how well we did, and we will share the recording with you and the links afterwards. Thank you so much. And could everybody go on, unmute your phone, and if everybody could give a round of applause to Nicole, Carl, and Dorcas, because I want them to hear the love.
I thank you guys so much for inviting us.
Thank you. And we are right at time, so thank you, Brande, for excellently facilitating this.
All right. Thanks, everybody. Have a good rest of the day.
Thanks, Brande. Thank you.